Hello, I'm Molly, and this is Care Experts, brought to you by CareCredit and Pets Best. Together, the CareCredit credit card and Pets Best pet health insurance provide all the financial tools that can help you be the best pet parent you can be. Today, we are here with Dr. Sharon Merrick. Hi, Dr. Sharon. Thank you so much for joining us.
How are you?
I'm well, thank you. Today, we are going to address a topic that can be really important for our cats' overall long-term health, which is their teeth. So if you could kindly tell us, how should I take care of my cat's teeth at home?
So a good nutritional diet's always good. There's plenty of different types of dental treats that are formulated for oral health in your pet. There's quite a bit of dental care options out there now. Brushing the teeth. If you want to brush your cat's teeth, there's certain things available for you to do so. There's water additives. There's actually dental diets made, prescription dental diets, which personally we don't recommend because it will turn your cat into a little sausage. But to give 1 or 2 kibbles of a dental diet treat daily is good. So there's a lot out there for that, but it's very important in their overall health.
And would you say that our cats need to have their teeth professionally cleaned in their life?
Absolutely. So cats a little differently, same thing. You figure, they're reality. You're not brushing your cat's teeth 2 and 3 times a day. What would your teeth look like if you didn't brush them? So they can get bad. Routine prophylactic dental cleanings are good for their mouth. One, the doctor is able to actually get in that mouth and actually look at all 4 quadrants of the mouth and check for, you're not going to see the teeth way back here in a cat. They're not going to be, here you go, take a look. So when they're under a general anesthesia for a professional cleaning, the doctor is able to check any type of recession of the gum lines, any possible fractured or problematic tooth. So that is definitely recommended to have that done. Definitely, promotes better health for your pet overall.
And would that be something I would consult my vet on as far as how often I should have my cat's teeth professionally cleaned?
Yes. And again, so your cat minimally should have an annual visit. It's now just better medicine and better recommendations to at least do semi-annual exams, whether they're due for vaccines or lab work or, anything. It's just always good for that semi-annual exam, twice a year minimal, unless they have some other concerns in their life that they need more frequent. But, you do this thing called flip the lip. You lift their lip up and you look at those teeth. And if you see, certain things you're looking for, will be recommended. Hey, I see a lot of gingivitis in here, periodontal disease. We have a large accumulation of plaque and tartar built up. We need to get your pet in for a dental cleaning. So one of the things that you got to keep in mind is cats with their teeth are a little different than dogs. Dogs may get a bad tooth and they have an extraction, where cats actually get what's called resorptive lesions. They basically reabsorb them teeth into their mouth, which sets the precedence for a whole nother issue, with your pet.
Wow, I had no idea. That's fascinating. And if I was going to be one of the brave cat owners that tried to brush their cat's teeth every day, what would I use? Do I use a human toothpaste and toothbrush? What would I use?
So you don't use a human toothpaste. I don't think the cats would be it'd be too tasteful for them. Plus there's things in human toothpaste that can be harmful to your pet. There are pet-friendly toothpaste made. They call it, it sounds kind of odd, but malt flavored. Like malt, M-A-L-T, seems to be one of the favorites in dogs and cats. There's tuna flavored toothpaste. So a couple ways, again, if you got a really sweet kitty that's going to let you put things in their mouth, the toothpaste is made to be pleasant tasting to them. There's a couple different options. You could use a human toothbrush. They make pet toothbrushes, of different sizes for littler mouths. They also make finger brushes where it has the bristles on the end of a little finger insert so you can kind of go in. Some people use a gauze because because it's a little abrasive, and they'll put a little gauze wrapped around their finger, a little toothbrush, and gently wipe the teeth with that. So if you're going to be brave, definitely there's a multitude of ways to get that toothpaste in their mouth. Only veterinary pet approved toothpaste, though. No human toothpaste. It's bad for them.
Got it. Good to know. And then how often should I brush my cat's teeth per day?
Well, I mean, if you're going to go with the true recommendation, yes, you should brush your pet's teeth every day, at least once a day. But again, in reality, most pets don't actually get their teeth brushed. It's easier said than done, which hence is why we have a lot of other things that we have now that are available to pet owners to care for oral health.
And are there any types of foods that would help clean my cat's teeth?
So yes, there's dental specific treats that are formulated to kind of when they crunch on them, they scrape the teeth to keep them clean. Again, if we have a severe oral periodontal disease or a severe buildup of plaque and tartar on the teeth, those treats aren't really going to help, or those diets that have the dental specific aren't going to very much help if we've already got an existing problem. That needs to be addressed, and then you go with prophylactic, being proactive going forward. So your dental treats, your dental diets, your different type of oral hygiene care that's available for your pet.
That's great. And you mentioned earlier the flip the lip trick to check your cat's teeth. If for some reason you're not able to do that, your cat doesn't want to let you do that, what are some other ways that you can tell that your cat might need a professional teeth cleaning, or signs that they might be having dental issues?
Some common signs, sometimes you'll see them pawing at their face. You notice when they're crunching on their kibble, maybe they're acting a little uncomfortable. Maybe even decreased appetite, which could be a sign of dental disease, but could be other things. So that warrants, immediate intervention with them. But again, most cats are temperamental. They're not nice when they don't want to be. So again, you can see changes in their behavior. Again, decreased appetite. You notice that an uncomfortable feeling when they're chewing their food. Sometimes you might see a little blood tinge in their water. If you notice like there's some kind of weird discoloration, brownish, pinkish tint to the water, we may have some bleeding gums, and that's getting into the water when they're licking their water bowl in their water bowl. So, different signs. And again, if your pet better than anyone. If there's something off, you're going to be, as their pet owner, you're going to be the first to notice that. And when you notice something's off, figure out what it is. And again, if it's not something that's screaming, hey, this is the problem, then again, your veterinarian's there for a reason.
Absolutely. So as far as the dental chews and treats that we've talked about, are there any in particular that you think work better than others?
They're actually, some of the prescription lines, they have like a dental health diet. And again, I've never seen anyone actually recommend feeding that as a full-time food. Usually they come in small 3 to 6 pound bags. So you can buy a bag of those, and it's actually supposed to be a diet. It's made to be a diet, but again, it's usually too rich or too much to feed on a regular basis as their diet. So a lot of people will buy a bag of the dental diets, which again, that's what it's called, dental health diet, and they'll feed those kibbles to the pets as a treat. So a few of those a day. There's Greenies makes a great dental diet for both cats and dogs, or dental treat for both cats and dogs. The cats love them. They have a couple. They actually have a catnip flavor and then some kind of fish flavor on the dental treat. So.
Okay, that's good to know. I might have to pick some of those up. So, Dr. Sharon Merrick, what would some of the consequences be if I were to not brush my cat's teeth and not get them their professional cleanings?
Well, I mean, you can, just like with people, if you got a lot of bacteria in your mouth that goes unaddressed, one, it's painful. So they're not going to feel great. that bacteria can cause heart disease. It can get into the bloodstream, causing, a slew of metabolic diseases. Are we affecting the heart? Are we, have a bacterial infection in the body because, the mouth is so bad inside? Teeth sometimes just rotting in their mouth. That's painful. And you got to understand, if a cat doesn't eat, that's a problem. Cat can't go days without food. Like, some people will say, oh, eventually when they're hungry, they'll eat. No, if cat does not eat, that causes, again, a slew of other issues. One of the main ones that's a concern is accumulation of fat in the liver, which causes what's called hepatic lipidosis, that's a whole nother ball game, and it's life-threatening. So, keeping that mouth as pain-free and as healthy as possible is so important. My main concern with bad oral health is, one, that mouth becomes painful, the cat doesn't eat, then we're in trouble.
Absolutely. And we do not want that. So I want to talk about excessive drooling, because we've talked about a lot of the specific teeth issues or signs that your cat could be having issues with their teeth. But what about the mouth in general? If we see signs of excessive drooling, or are there any other symptoms of problems that could be affecting the mouth?
So the drooling, yes, absolutely. Cats, anytime you see a cat drooling, you got to figure, why are they drooling? Okay. It's not normal for cats to drool. There's something wrong, whether it be, they've got just hypersalivation from a bad mouth, and it's just, the yuck is just dripping out of their mouth basically, or are they hypersalivating for other reasons? Main one, toxicity. So, again, when you see hypersalivation, there's something going on. Something happened that's caused. They don't just drool. Like a dog will drool, like, oh, yummy. They're going to just slobber and drool, whatever. Cats don't do that. That's not normal for that.
That's good to know. So if you see your cat drooling, it's a sure sign that something's not quite right.
Correct.
And call your vet, I would take it.
Yes.
Can you tell me, what is feline stomatitis?
Ooh, stomatitis. Basically, it's a bad immune response from the body in the mouth. You may hear certain people call it red mouth disease. Basically, the inflammation in the mouth is horrible. Sometimes, it needs to be treated, obviously. A lot of, just depending on the level, on what your thoughts are and the level of dental, opportunities you have available to you, dental x-rays to check what's under the gum line, because sometimes what's under the gum line is horrible. But basically, stomatitis, you get ulcerations in the mouth. It's a bad immunity response to, basically whatever's going on in the body. Sometimes it ends up in being full mouth extractions. Some vets opt to give a steroid and antibiotic injection and see how it does. Sometimes they need that periodically. Any long-term use of steroids is not good, but so it's something that needs to be addressed. It's, ulcerations in the mouth. Again, here we are back to pain. Pain in the mouth makes you not want to eat. And then we got more issues.
It's amazing that in such a tiny mouth, so many health problems could come from that, right?
It is. And, and I got to say, the best preventative care, that's key. Preventative care. There's prophylactic. Don't wait till that mouth is problematic before getting those teeth cleaned. Just don't wait. Follow your recommendations from your veterinarian. Even if there's mild tartar buildup, a routine dental cleaning under anesthesia is healthy. It's part of, health for your pet. One, they're not going to let us scale their gum line in their mouth while they're awake. So unfortunately, general anesthesia is where what happens needs to occur for us to get a proper cleaning and diagnostics of the mouth. But, it's so important.
It really is. And this has been incredible information for all of us as cat owners. So thank you so much, Dr. Sharon Merrick. We really appreciate your time.
You're welcome.
More episodes of Care Experts can be found at carecredit.com/careexperts. All of our featured Care Experts recommend and accept the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. For more information on how Pets Best Pet Insurance can cover up to 90% of your pet's unexpected eligible veterinary expenses, visit petsbest.com. Or for more information on the CareCredit credit card, go to carecredit.com.
Thanks for joining us on Care Experts with CareCredit. If you enjoyed this episode, please subscribe and share with friends and family. And stay tuned for new episodes every week. This content is subject to change without notice and offered for informational use only. You are urged to consult with your individual advisors with respect to any information presented. Synchrony and any of its affiliates, including CareCredit, collectively Synchrony, makes no representations or warranties regarding this content and accepts no liability for loss or harm arising from the use of information provided. All statements and opinions in Care Experts with CareCredit are the sole opinions of the guest. Your receipt of this material constitutes your acceptance of these terms and conditions.